I'm Kim Kaluger, and this is task 19. I'm keeping a patient records. And I have here a golden retriever that we did a mass removal on today. And this is the chart. It's a rather large chart. They have several animals. But in the chart I have the Antec diagnostics for the mass, that the biopsy and the histopathology. So it's a 3.5 centimeter mass, ventral abdomen, excised down to body wall, seemed well encapsulated. Then I have here, this is the sheet that we sent out for review, the biopsy review. I've got here, the dog's name is Sally, so we've got the authorization for anesthetic procedures and microchip placement, and it's got the client's name, the pet's name, anesthetic and surgical procedure to be performed, and it was a mass removal. It's got the phone number of the client and the pet's age, and then the authorization and the diagnostic tests. The dog has had recent blood work within 30 days. We always do that within 30 days, or we do an in-house blood work from the morning of. Home again, microchip placement. The dog has already been microchipped, and then the signature, which is really important for authorization for anesthetics. Then we have here the actual surgery record. On the surgery record, we've got the date, the doctor, the technician, the procedure that was done. It was mass removal, and she also got a dental. Lab work we had already done. The size of the catheter, which was a 20 gauge catheter, and it was on the front right cephalic vein. The IV fluids were administered at 480 mils, and it was LRS. The ET tube was 10.0. Respiratory bag size was a 4. And the pre-anesthetic drugs, the dog was pre-medded with hydromorphone at 10 mg per mil, and the dose was 0.5 mils. The route was IM, and we have the initials of the doctor and the time that the pre-med was given. Then we have listed the induction drugs, which the induction drugs were diazepam and propofol. And diazepam was given at, is 5 mg per mil, and that was given 2.1 mLs, and the route was IV, and the time was 12:10 p.m. And then propofol was at 10 to 11 mLs that were given to effect. So, and that was given also at 12:10 p.m. IV route. The other notes we have on the anesthetic sheet, the dog needed an ear cleaning, a nail trim, and anal glands expressed, and those were all done. And then the next thing we have here is the anesthetic, on the anesthetic sheet is the time every 5 minutes, and we record the ISO that the patient is at. So here looks like they maintained 2.5, went up to 3.5, and then back down to 2.5. SpO2 rate throughout the procedure, the heart rate throughout the procedure, the respiratory rate throughout the procedure, the temperature throughout the procedure, CRT throughout the procedure, which was less than 1, which is good. Mucous membrane color was pink the whole time. And then the blood pressure throughout the entire procedure, and we were looking for the mean arterial blood pressure. And then the fluid rate. And then the total volume infused, and we have the anesthesia start and end time, the surgery start and end time, extubate time, pre-op temp, post-op temp, and if there's any post-op laser treatment, this dog did not require that. Then down at the very bottom we have the patient's name, or the client's name, the patient, the client number, the patient number, the species, the age of the patient, the sex of the patient, and the weight in both pounds and kilograms. So that is our anesthetic record. I'm going to go ahead and log and then underneath the most current sheet, dated 7/11/17, we've got, this is the doctor's records, chief concern, mass removals, histiopath. We've got eating, drinking, fine, general appearance was good, oral cavity is the A, eyes, ears A, cardiovascular, respiratory, gastrointestinal, duodenal, musculoskeletal, nervous system. Those were all noted by the doctor. And then any prescriptions that were given to go home with the dog. She's got a prescription here for Rimadyl at 100 mgs, 2 times, 2 per mouth every 24 hours for 5 days, and the total number of 10 were given. And then another prescription for Tramadol at it's like 50, and that was 2 by mouth. 2 masses on the ventral abdomen were done. It says here the dog was obese, and there were 2 masses. The mass removal and dental prescription, and then these are just the doctor's notes. The doctor did have to make several puncture marks that look almost like a skin biopsy to stretch the skin enough to close. So she did note that, and the dog went home with a bandage around its abdomen. I'm going to go ahead now and log the controlled drugs. So again, that was hydromorphone. So we have the controlled drugs all listed by tab. So the hydro is actually our first one. So I'm going to go ahead and write down. So it's hydromorphone. It's the container size is 5 mils. The strength is 10 mg per mil, and the form is an injectable. Then we put the date that the hydro was given, the patient's name, and her name was Sally Bennington. And the open bottle number, and it's got the open bottle number on here. The unique bottle is 16-24. And then I write that in, and then the amount added or used. So the amount was 0.5 mLs. So what it was before was 4.83. Minus 0.5 equals 4.33, and then my initials. And then I'm going to go ahead and also log the diazepam. And the diazepam is, it's 5 mg per ml, and it's injectable, and the unique bottle number is bottle number 17.16. The amount used was 2.1 ml. So the total from before was 2.69 minus 2.1, leaving us with 0.59. And again, you put the patient's last name, and then we always put the patient's first name in parentheses. The other drugs that we have listed in here are butorphanol. We also have ketamine, buprenorphine, euthazol, tilazol, and midazolam, and fentanyl. So that is it on the patient chart. And then the doctor, when there are labs pending, the doctor, this particular doctor likes to keep the chart at her desk. We also have a rack up front where we keep the charts that have labs pending. And then when they get the labs back, the doctor will go ahead and give the patient or the client a call and go over the results with them.